Hello and welcome back. Today, we have an exciting topic to discuss that holds the potential to revolutionize the way we think about health and well-being. If you're someone who's been looking for a natural solution to enhance your body's healing and recovery, then you're in for a treat. We're diving into the world of peptide BPC-157. In recent years, the realm of medical research has witnessed a surge in the exploration of innovative treatments to accelerate healing and recovery processes. One such promising avenue is the peptide BPC-157, which has garnered significant attention for its potential to aid in tissue repair, reduce inflammation, and promote overall wellness. This video delves into the intricacies of BPC-157, shedding light on its mechanism of action, potential benefits, and current state of research. In the realm of peptide research, BPC-157 has garnered significant attention for its potential therapeutic applications and regenerative properties. BPC-157, short for Body Protecting Compound 157, is a synthetic peptide consisting of 15 amino acids. Originally isolated from gastric juices, its remarkable ability to promote tissue healing and protect against various injuries has piqued the interest of researchers across different medical disciplines. One of the most intriguing aspects of this peptide is its role in accelerating the healing process. Studies have suggested that this peptide plays a crucial role in angiogenesis, which is the formation of new blood vessels. By stimulating angiogenesis, BPC-157 may contribute to improved blood flow to damaged tissues, facilitating faster recovery from injuries. Additionally, BPC-157 has exhibited anti-inflammatory effects, which further aid in reducing tissue damage and promoting healing. It's important to note that while the initial findings surrounding BPC-157 are promising, further research is needed to fully understand its mechanisms of action, potential side effects, and optimal dosages for different medical conditions. As with any peptide or compound under investigation, cautious and methodical exploration is vital before translating these findings into clinical applications. As the scientific community delves deeper into the intricacies of BPC-157, its therapeutic potential and practical utility may become clearer, offering new avenues for addressing various injuries and medical challenges. The potential benefits and applications of BPC-157 is musculoskeletal healing. One of the primary areas of interest for BPC-157 is its potential to accelerate the healing of musculoskeletal injuries. Studies have indicated that it may promote the regeneration of tendons, ligaments, and muscles. Athletes and individuals recovering from injuries could potentially benefit from its ability to enhance tissue repair and reduce recovery time. Another benefit is the protective effects on the gastrointestinal tract. Research suggests that it could be effective in treating conditions like inflammatory bowel disease, gastric ulcers, and even pancreatitis. By promoting the healing of damaged gut tissues and regulating gut motility, this peptide may offer a novel approach to managing these challenging disorders. Anti-inflammatory properties. BPC-157 has demonstrated anti-inflammatory effects in various studies. Chronic inflammation is implicated in numerous health problems, from autoimmune diseases to cardiovascular issues. If BPC-157's anti-inflammatory properties can be harnessed effectively, it could hold promise for mitigating a wide range of inflammatory conditions. Pain management. Its ability to modulate pain receptors and alleviate discomfort makes BPC-157 a potential candidate for pain management. By addressing both the underlying causes of pain, such as tissue damage, and the perception of pain, the peptide might offer an alternative or complementary approach to traditional pain relief methods. Wound healing. BPC-157's pro-angiogenic effects, which stimulate the formation of new blood vessels, could have implications for wound healing. Improved blood circulation to wounds could facilitate faster healing and minimize the risk of complications. Neurological health. Some studies have explored BPC-157's effects on neurological function and brain health. While this area is still in its infancy, early research suggests that it might have neuroprotective properties and could potentially be relevant in conditions like traumatic brain injuries and neurodegenerative disorders. It's important to emphasize that despite these promising potential benefits, BPC-157's mechanisms of action and long-term effects are not fully understood. As research progresses, a clearer picture of its safety and efficacy will emerge. While the excitement surrounding BPC-157 is justified, cautious optimism and rigorous scientific investigation are essential as researchers continue to unlock its therapeutic potential across various medical fields. Clinical trials involving human subjects are limited, and more rigorous studies are needed to establish the safety, efficacy, and optimal dosages of BPC-157 for various medical conditions. As of now, the current state of research on BPC-157 suggests its potential as a therapeutic peptide for promoting tissue healing and protection. However, a substantial amount of further research, including well-designed clinical trials, is essential to fully understand its mechanisms of action, potential benefits, and any associated risks. It's advisable for individuals interested in this peptide to consult with medical professionals and stay updated on the latest research developments before considering its use for any specific medical purpose. One of the primary safety concerns surrounding BPC-157 is its limited clinical testing in humans. Most of the existing research is derived from animal studies, particularly rodent models, which might not accurately reflect the potential effects and risks in humans. Therefore, extrapolating these findings directly to human use requires caution. Additionally, the long-term effects of this peptide on human health are still largely unknown, making it challenging to assess its safety profile comprehensively. Another aspect to consider is the route of administration. BPC-157 is often administered through subcutaneous injections. While this method is commonly used for peptides, improper injection techniques could lead to infections, discomfort, or other adverse reactions at the injection site. Sterility and proper dosing procedures are crucial to minimize these risks. Furthermore, interactions with other medications or medical conditions are worth investigating. BPC-157 might potentially affect blood clotting, which could be problematic for individuals taking anticoagulant medications. In conclusion, while BPC-157 shows promise as a potential therapeutic agent for promoting tissue healing and recovery, its safety considerations remain a critical aspect of its usage. As of now, its human clinical data is limited, and more research is needed to establish a comprehensive understanding of its safety profile, potential side effects, and interactions. Anyone contemplating the use of BPC-157 should prioritize consultation with medical experts and adhere to proper dosing and administration guidelines to mitigate potential risks. It's also important to stay updated with the latest research developments regarding BPC-157 and its safety considerations. And there you have it. Peptide BPC-157, a natural marvel that has the potential to transform the way we approach healing and well-being. If you found this video informative, don't forget to give it a thumbs up and subscribe for more fascinating insights. Thanks for tuning in, and I'll catch you in the next video.